We're back now with today's checklist and important information for American Heart Month. Heart disease is the leading cause of death in the U.S. for both men and women. So this morning we are focusing on prevention and ways to improve our health. Dr. Stacey Rosen is the American Heart Association's incoming volunteer president. Dr. Rosen, good morning.
Welcome back.
So every year the American Heart Association puts out a report basically saying here's how we're doing in the whole heart disease department. What did you find this year?
Well, unfortunately, we found that heart disease remains the #1 cause of death for both men and women, and we've not been able to change that. It causes more deaths than all cancers and accidents combined.
Wow.
But we also learned that medical advances have had an amazing impact on our ability to live longer and live healthier.
Okay, so tell us about life's essential 8. These are the things we should be doing to live longer.
Absolutely, and they involve 4 health factors and 4 health behaviors. So the health factors are to manage blood pressure, manage cholesterol, lipids, manage your blood sugar, and manage your weight. And the health behaviors are marvelous because they're things we can do. Be more active, move more, eat better, quit tobacco. And we went from 7, simple 7s, to essential 8s by adding sleep. So getting healthier sleep is critical.
And I know that women is a priority here. You want to keep a focus on women, making sure they are heart healthy, because there are specific risks for women, right? Tell us what you've learned.
Yeah, no, absolutely. And before I get to that, it should be known that only about 45% of women know that heart disease is their #1 risk.
Wow.
And women experience unique life stages that impact. So for some women, it can be things like when they get their first period, how many pregnancies they have, whether they had any issues during pregnancy, high blood pressure, diabetes. It can also be what menopause is like, whether you get into menopause early or late, whether you have symptoms, the hot flashes that we talk about. So all of those things that are really unique to women's lives have an impact on heart health.
Stacey, how do you know, Dr. Rosen, how do you know when to see a cardiologist versus your PCP, your primary care physician?
That's a great question. So heart health and the diagnosis and evaluation starts in our teens and 20s, but it doesn't necessarily have to be with a cardiologist. It could be with your gynecologist, with your PCP. But as you get older, if you're someone that has risk factors, a family history, or certainly if you have any symptoms, you may want to go ahead and see a cardiologist.
So heart disease runs in my family, and every once in a while, I've told you before, I get like this pain in my heart, and I've been to a cardiologist. Oh, it's nothing, you know, but like when should you really be concerned and maybe go to an ER or, you know, be seen right away?
Well, I'm thrilled to hear that when you had symptoms, you didn't dismiss them or minimize them.
You forced me to go to the doctor.
She took a while to get her there.
That's what partnerships are for.
Yes.
It's perfect. You know, anything that feels strange to you, because sometimes we talk about the Hollywood heart attack, chest pain, but sometimes women particularly will have stomach pains, back pains, jaw pains, neck pains. So our general message is don't ignore anything and find a doctor that takes you seriously so that your evaluation can really fit what your risk factors and symptoms are.
It's very helpful, Dr. Rosen. Thank you so much.
Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.